Food banks and healthier eating is a bigger priority than you think. We've reported before how food banks across the country are implementing merchandising tools to increase the amount of better-for-you foods that their recipients are selecting. Catherine Diamato, the CEO of Greater Boston Food Bank, tells WBUR Radio that 20 years ago, we couldn't move a carrot. It wasn't in our culture. It wasn't in our commitment. But now, she says, food banks have evolved and fresh, more health-conscious foods have become a priority. The idea that food is medicine, food is health, is more mainstream, D'Amato says. Walk into one of our member pantries now, and it looks like a Whole Foods. Now, for the first time in the U.S. and in Boston, incentives are in place for certain health systems to be concerned about the nutritional aspects of their patients' care because they hold the financial risk, says Lauren Taylor, a PhD student in health policy and management at Harvard Business School. The Greater Boston Food Bank announced last year that it was the first major food bank in the country to hire a medical doctor. In her first year at the Greater Boston Food Bank, Dr. Catherine Radowski, a preventative medicine physician, launched a public health initiative aimed at improving patients' health and ultimately lowering healthcare costs. She says that hunger and health are intertwined, and that we know that the food insecurity is linked to chronic disease in both adults and children. Healthcare and hunger relief organizations are natural allies, and we need to engage with this sector. So what are they doing? An idea that supermarkets, with or without clinics, might want to consider. Free monthly mobile farmers markets at several local community health centers that serve low-income patients. Volunteers set up tables overflowing with 6 to 8 varieties of fresh fruits and vegetables, beets and string beans, lettuce, tangerines, apples, and grapes that are distributed by the food bank. Any patient from the health center, whether they're prescribed produce by their doctor or learn about the market from the center staff, can collect up to 25 pounds of free fruits and vegetables per family at a time. Smart and healthy.